How do antiseptic mouthwashes impact nitric oxide production? And maybe even fluoride. How does fluoride impact?
Well, these are antiseptics, right? So anything that destroys the bacteria that live in and on our body.
Okay.
So about 25 years ago, we and others discovered that the oral microbiome, there's some what we call nitrate-reducing bacteria that metabolize nitrate from our diet, converted into nitrite and nitric oxide, and that dilates blood vessels. And so for years, it was thought to be an association, right? We published in 2014 that people had the least greatest diversity in the oral microbiome had elevated blood pressure. So it was an association, but not causation. Then in 2019, we published a clinical paper showing if you take normal intensive patients that are unmedicated, good diet, good perio, full oral exam, and the only thing we do is give them antiseptic mouthwash twice a day for 7 days, their blood pressure goes up. So now that's causation. So we're killing the oral microbiome, we're shutting down nitric oxide production, and their blood pressure goes up. And furthermore, you lose the protective benefits of exercise. So this is extremely important now in modulating endogenous nitric oxide production by targeting the oral microbiome. And now we're doing the reverse. So we're taking patients with resistant hypertension, which, as you know, they're resistant to standard therapies.
Right.
And now we simply ask them, are you using fluoride toothpaste? Are you using mouthwash? I developed a fluoride-free toothpaste that targets the microbiome. So we switch their toothpaste, we get them off antiseptics, and their blood pressure comes down.
Amazing.
So, I mean, think about how profound that is, because
it's huge.
Hypertension's the number one driver for the number one killer of men and women worldwide. And 50% of the people that are given prescription antihypertensive medication don't respond with better blood pressure.
So for people listening or for clinicians listening, you know, you've got a patient in the exam room, or you know personally at home with your home cuffs that your blood pressure is now 130 over 80 or 90 or, you know, somewhere in that range. Before we start thinking medications, we should almost be doing a checklist of sorts, looking at the oral microbiome.
Sure.
It sounds like you're saying it's first. Look, I would have not thought of that, to look at the oral microbiome first. So looking at the oral microbiome first, repopulating that by reducing fluoride and antiseptics.
Yep.
That's our starting point. Where would we go from there?
Ask them if they're on antacids.
Okay.
You know, there's, I think, 200 million prescriptions written for antacids every year.
Yeah.
And now you don't even have that prescription. You can get Prilosec, Prevacid, you can get these over the counter.
Over the counter.
Proton pump inhibitors. And then you've got to work with those patients and wean them off those drugs.
Right.
You know, these aren't drugs you can stop cold turkey.
You'll rebound. Yeah.
You'll rebound. It's going to be miserable.
Yeah.
So you have to figure out a way to wean them off these over time. And now you've released the brakes on the body's ability to naturally produce nitric oxide. And then what we can do? Well, we can change their diet, get rid of simple carbohydrates, anything that leads to an increase in blood sugar. Throw in some more green leafy vegetables, which are enriched in inorganic nitrate. Moderate physical exercise. You know, we used to say 20, 30 minutes of moderate physical exercise a day is sufficient. Now we know that, 4 to 6 minutes of high intensity interval training. Anything that gets your heart rate up, your breath rate up, will activate and stimulate nitric oxide production.
4 to 6 minutes.
4 to 6 minutes.
We can all do 4 to 6 minutes.
Time is no longer an excuse.
We can't say we're too busy. So,
That's right.
And that's high intensity. So that's, where does that how much of a heart rate rise would you recommend?
For me, I'll tell you what I do personally, and it's worked for me because I get up every morning. I usually sit in an infrared sauna, but before I do
Does
that,
that raise nitric oxide?
Well, it helps. It modulates nitric oxide production. So it's helping you to detoxify, get rid of things that are inhibiting nitric oxide production. And then the red light is activating our mitochondria, releasing nitric oxide that may be bound to metals. But I do 100 squats, 100 push-ups.
Okay.
And then I do some stretching
100
exercises.
push-ups?
100 push-ups. So every morning when I get up, whether I want to or not.
I'm at 5 right now, but okay.
Well, I started out doing 4 sets of 25, both squats and push-ups.
All right.
Now I'm up to 2 sets of 50.
Okay.
But I do 12 minutes. So that takes me about 4 minutes to do 100 push-ups, 100 squats. And then I do stretching. And then a lot of times, if I'm at home, I'll do like 10, 40-yard sprints.
Okay.
But all in, I'm 20 minutes.
Yeah.
And I've got an excellent workout in. I'm sweating. My breath rate's up. My heart rate's up. I mean, that high-intensity interval training, your heart rate may get up to 140, 150 or higher.
Is it a good idea to use your heart rate as a measure of how much intensity you've got? Like, for example, rough rule of thumb, should you double your heart rate? Should you go 1.5 times your heart rate? Is that a way to know that you're in that zone that I'm assuming also helps you increase nitric oxide production?
I don't know if that's been studied on its effect on nitric oxide production, but obviously you have to have clearance. I mean, you don't want to go in with a
Right.
poor functioning heart and try
Right.
to increase your heart rate.
Right.
Not what I'd recommend. But no, I think what's happening is we're fully oxygenating. The other big thing is nasal breathing. If you can focus on nasal breathing instead of mouth breathing, because just like our endothelial cells, our epithelial cells have a nitric oxide synthase enzyme. And when we do nasal breathing, it activates. We're delivering nitric oxide down to the pulmonary vasculature. It's dilating the bronchioles, dilating the pulmonary arteries, and we're improving oxygenation.
Wow. So correcting any airway abnormalities becomes important too.
For sure. So that's the other thing. Most Americans are mouth breathers, and it's leading to detrimental outcomes. I mean, the mouth is not an instrument for breathing. It's an instrument for talking. So when you do mouth breathing, you're completely changing the oral microbiome. You're completely shutting down nitric oxide production, and you're bypassing this nitric oxide production pathway through the nasal sinuses.